Hi, I'm Cathy Ulrich, CEO of Northern Health. Dr. David Bowering, who is one of our medical health officers, released a men's health report that talked about the health and well-being of men who live in northern British Columbia. Recently, we have hired a men's health coordinator to lead the work with communities on men's health. Today I want to introduce you to Brandon Grant, who is our men's health coordinator, and he's been working with communities across the north on initiatives that improve and promote health for men.
Well, it all started with Dr. David Bowering's Chief Medical Health Officer report, Where Are the Men? And in it, he outlined a number of concerns about the health indicators of men living in northern British Columbia. And men are dying on average about 5 years earlier than women. And they're dying of virtually all causes, like high rates of cancers, chronic disease, and even occupational accidents at work. So Northern Health has made a commitment to ensure that we're starting to look at some of the things we can do to improve health outcomes for men living in the north. Well, one of the great things I got to do on my first day of work is I got to be a part of the community consultations on men's health that we had across the Northern Health region. So I got to go to communities like Prince Rupert, Houston, Fort St. John, Fort Nelson, and hear from men living in those communities about where are areas where we can work together to improve men's health outcomes living in the north. So we're already moving on some of the recommendations we heard from men living in these communities.
The other part is, I think that often men, like women, don't want to know. They'd rather, in some ways, you don't want to do testing because you don't want to find out you have a problem. And to that, I just say, really, problems grow exponentially the longer you leave them. So getting the testing done and finding out you might have results that need further investigation is actually a good thing, because then there's something you can do about it.
So we'd like to welcome Brandon to the Northern Health staff and thank him for the awareness that he's already bringing to men's health work across northern British Columbia. I look forward to sharing more of this work as it unfolds over the next number of years. See you next time.